Attention listeners, Aftersight's annual hike is coming up on July 27th.
It was a really good experience for me.
Visit aftersight.org/hike and become an audio trekker today.
That hike today gave me so much courage.
You're listening to an AINC original podcast. We believe you don't have to do life without a compass. Let us be your guide on this amazing journey. Welcome to Navigating Life with Vision Loss.
Hello, I'm Kim Wardlow. I'm your host here at NLVL. We are in the month of May, and we are looking at different aspects of mental health this month. Before we get into our topic for today, I just want to let you know that Game Changers will be launching on June 6th. I'm really excited about that new show. It's going to focus on adaptive sports. Our annual hike will be July 27th at Myers Gulch. And you can register for that on our website, which is just www.aftersight.org. So definitely go on there and register. We're super excited this year for our hike. Lots of fun things planned around the hike, and lunch and breakfast and everything included with that. So check that out. As I said today, we're looking at an aspect of mental health that I don't think we have before in NLVL and perhaps not in Blindsight either. I'm not 100% sure. But looking at medications, vitamins, supplements, and maybe even other supports that a person might need in terms of their community, whether that's family or friends, if they're looking to manage a mental health issue or are seeking some recovery from mental health issues. So we have joining us today, Angie Flynn. So I'm super excited for Angie to be here with us. I've known Angie for a while, and she is a nurse. But I'm going to let you tell a little bit about your background. I don't want to leave anything out, but a little bit about your background. I know you've spent many years working in hospitals, but you're not doing that now. You're at Colorado Recovery. Is that right?
Yes. Well, hi, Kim. Thanks for having me. And yeah, I've been a nurse, a psychiatric nurse for, it's been over 40 years now. And in that role, I've been a clinical team leader, a charge nurse, a case manager. I've run groups, drumming groups and cognitive behavior therapy groups. And currently I work at an outpatient program where we manage medications and we do groups and therapy for clients living in the community.
Well, I appreciate you coming on today and talking about this topic, because I think so often mental health in general, I think though we're talking about it so much more than we used to in the past, there still can be some stigma around that. And certainly I feel like there's still some stigma or concerns if a person is considering taking a medication for a mental health issue. So I appreciate you coming on to talk about that and provide folks some information. Obviously, what we're talking about here today is not to be seen as actual medical advice. And certainly before you would take any medication or even a vitamin or supplement, you should consult your doctor first. So we're not recommending that you take any specific medication or supplement, but just to give you some information about those. So if you are talking to your doctor, you may have some background and be able to ask some informed questions. So Angie, when might a person consider taking a medication or a supplement? Do you try vitamins and supplements first, or does it just depend on what the person is needing?
I think one of the first things you need to do is talk to your provider about what your experiencing. And it's good to get a medical checkup first. A lot of times there are things that can look like a psychiatric issue where it's a medical issue. And I'll just give you an example. I've seen this particular thing maybe 4 or 5 times in my career, but particularly with older women with a urinary tract infection, it can look like something cognitive is going on. It can even look like psychosis. And they get on antibiotics. The infection clears and the symptoms totally go away.
Right.
So it's really important that you get checked out medically and make sure that it's not something like that. It's not a deficiency. I think 40% of Americans are deficient in vitamin D. So, sometimes it's good to have the doctor check those kind of levels, and maybe you just need a supplement like vitamin D or something else is going on. So I would suggest getting a medical checkup first. And then if you do speak to your provider, and I can talk about specific supplements later, but if you're talking to your provider first, you need to be honest if you are on supplements and tell them what you are taking, and because that can interfere with what they might be prescribing. Right. And I can talk about that in more detail when I talk specifically about supplements. But the broad categories of medications that a doctor is going to prescribe for mental health issues follow under 4 major categories, and these are antidepressants, and a subcategory or second category would be anti-anxiety medications. Then there are mood stabilizers and anti-psychotics. With those medications, the doctor, prescriber, and you together need to decide the risk-benefit analysis of what symptoms are you trying to control and what risk are there as far as side effects. But beyond risk is what do you need to do as far as monitoring your health when you're on these medications. And I can go through each category and sort of broad stroke it for you and tell you things to look for each category. Also, another thing that you and your prescriber need to think about is that the least effective dose or the minimum dose needed to correct your symptoms. And that will help that you won't have as many side effects. So you want to take just the amount that help the symptoms. Again, speaking in broad strokes, I can tell you some things to look out for with the different categories of medications. Antidepressants, or the newer generations, are the SSRIs and SNRIs that deal with serotonin, norepinephrine. They have less side effects than some of the old school ones, like the MAO inhibitors, where you had to watch your diet. You couldn't eat red meats or anything with tyramine in it because it could cause a blood pressure crisis. They don't tend to prescribe those as much anymore unless the newer ones aren't working, that work on the serotonin level. One thing to remember about that is they'll tell you 4 to 6 weeks for some of them to work. So you have to be patient for them to work and give it time. The other thing that I read, in fact, today I saw this, where even after 2 months, only about 60% of people report a 50% reduction in symptoms.
Wow.
So
it does take some time.
Yeah. Yeah, it'll take some time. And if it's not working for you, talk with your doctor. There may be another drug in that category that will work better for you with a less side effect profile that will target certain symptoms better. Also, the timing of when you take a medication can help. Or, like I said, they can just prescribe it a different way or a different category. So be patient and realize that the first time you're prescribed something may or may not work like you want it to. So it takes time. The second category, anti-anxiety medications, a lot of times they use the antidepressants, particularly the ones that work with serotonin, norepinephrine, acetylcholine. They'll use those for anxiety as well. But there's also a category of drugs that include like Xanax and Klonopin that have a high profile for addiction, and also they're hard to come off of. So that's just something to think about. A lot of times the doctor won't go straight for prescribing those. They'll try an SSRI first, and before they prescribe the ones that have more of an addiction profile and are harder to get off of, you need to wean off of them. As far as mood stabilizers go, these are things like lithium and anticonvulsant medications. An important thing to talk to your doctor, particularly for lithium, is that you need to know that you will have to get your thyroid checked on a regular basis, because over the long term, it can affect your thyroid. And some of the mood stabilizers cause a lot of sedation that some people find intolerable. Again, it takes talking to your doctor. Sometimes it's simply changing the time that you take your medication, or maybe you're taking more of it at night, so the sedation occurs at night. It's important to be really honest with your doctor about what you're experiencing, and it may be a matter of just moving things around or a different drug in that category. Now, the more serious side effects that I've seen in my nursing career tend to occur with the anti-psychotics. While it's important to control symptoms, particularly if there's hallucinations, psychosis, things like that, you want to control the symptoms, but particularly the old school antipsychotics, and a lot of people don't realize this, can cause lifelong movement disorders called tardive dyskinesia, where you have tics and other things that will not go away. I mean, there are medications that can mitigate that.
But then you're on a second medication.
You're adding more things. Yeah. So it's good to know up front if the medications he's prescribing for that do carry that risk for a side effect. It's good to know that. And also, the antipsychotics often, I've seen this in my nursing career, can cause a lot of weight gain for some people, and your lipid profile, your lipids will go up, and that makes you more at risk for things like diabetes and heart disease. So it's good to know these things before you make that choice about which medications, like how much medications. And again, a lot of times if you're talking with your doctor, it's just simply a matter of changing the dose, or maybe moving it to different times of the day, or how they space it out can alleviate some of those risks. But those are some things to keep in mind with the prescription medications. So there are options, and the one you've seen advertised maybe on your computer or on TV may not be the right one for you. So it's really important to talk to your doctor about all the options and weigh benefits and risks. And then I would think it would be similar if you're looking at vitamins or supplements. Again, we're talking about whether it's prescription medications or vitamins and supplements, things that have had some research and studies, and they've drawn some conclusions that they do, benefit folks with different mental illnesses. Right. For the vitamins and supplements, actually, I did a group on this, and I use, it's called Therapy in a Nutshell on YouTube. It's a great therapist. She does research-backed information, and she talked about supplements for anxiety and depression. And there are more supplements for that type of thing than things like psychosis. It's not likely you're going to find a supplement that's going to help much with mood stabilization or psychosis. But there are things out there for depression, anxiety, difficulty sleeping. Things like St. John's wort or 5-HTP are things that can help with your serotonin, very similar to the SSRIs. Again, you need to tell your doctor if you're taking these supplements, because if you take these supplements, for instance, that affect your serotonin level, and you are taking an SSRI or an SNRI, it can cause serotonin syndrome, which is something you don't want. So make sure you tell your doctor, and that's from having too much serotonin in your system. So tell your doctor all the supplements you're taking, but the St. John's wort, 5-HTP have been shown to be helpful in depression. Theanine is one that is often used for anxiety, and that has been helpful for a lot of people. A lot of clients I talk to take that and find it helpful. Even something as simple as chamomile tea is helpful for sleep issues or anxiety. A lot of people, especially in the past, talked about kava kava.
Oh, right.
That's good as well, but it's more of a short-term thing because it's metabolized by the liver, so it can cause liver issues if you use it long-term. But I think there's a place even in Boulder that has like kava kava drinks and drinks that calm you down rather than the caffeine. I forget what it's called in Boulder, but occasional like coffee substitute that has kava kava is probably not going to hurt you, but you don't want to do it long term and like damage your liver or something like that. Again, with 40% of the population being deficient in vitamin D, sometimes just vitamin supplementation with vitamin D is helpful. And even being in the sun as little as 15 minutes per day where the sun is touching some part of your skin is helpful in getting those vitamin D levels where they should be. I don't know if I mentioned magnesium is good. You can have the spray on that you spray like on your abdomen
like
or
oil.
the pill form. Yeah. Those can help with sleep or anxiety. And then N-acetylcysteine or NAC, if you walk in a health food store and you ask for NAC, they'll know what you're talking about if you can't remember the big name. But providers that I know have actually prescribed this for OCD issues. And then if it's minor OCD, and I've talked to friends also that have this, and the N-acetylcysteine is very helpful with that. Again, talk to your provider, see what they think. They may have heard something in the research about these things that I just talked about. But I'm a big believer in supplements myself. And as long as you're not having a mental health crisis and you're dealing with a little bit of depression, then, sometimes it's good to try these things. But again, always talk with your physician first. Also remember that supplements aren't FDA. They don't go through the process and an approval. And so you need a reputable company to get your supplements.
Yeah, supplements aren't all equal in their efficacy. So, yeah, for sure. And your doctor probably can help you with that too. If you're wondering, well, what brand should I buy? They probably have some suggestions. And just because something's the most expensive doesn't mean it's the best, that kind of thing. So they could probably help you determine that as well, and the dosage.
Right, exactly.
Well, that's super helpful. I think just for people to remember that it's important that they tell their provider what they're taking. I think it's easy to think, well, it's just a vitamin or supplement, and I don't need to include that on my list of medications, but really they do need to know.
Right. Well, particularly before surgery too, a doctor needs to know every supplement you're on, like even fish oil, which is another one I forgot to mention that is often used for depression and anxiety. For instance, you can't take prior to surgery for, a couple of weeks. So it's important anytime you're at the doctor to let them know what supplements you're on.
I think that gives our listeners, a general background. Obviously, each person and their individual case and their individual symptoms need to be taken into consideration with their provider. But just to give a broad idea of what they might be looking at or considering if they're talking to their physician. But it's not just about taking a pill, of whether it's a prescription medication or a supplement. There are other things that really can help support our mental health. And I think you mentioned it just in the work you're doing. Your job is having groups, whether that's a formal group like you have in your workplace, or family or friends that can be supportive of what you're doing.
Yeah, I agree with it. And that's one thing that makes me excited about being a psychiatric nurse. And I love being a psychiatric nurse. because if you look at it holistically, there's so many things that can contribute to good mental health. And as you mentioned, having a good supportive family. And if they're not good and supportive, then make your own family, find friends that do that for you. But we co-regulate each other. We provide those safe places for each other where scientifically, I'm not just making this up. If you look up polyvagal theory, if you're around people that co-regulate you and keep you in a calm space, that's where healing happens. So you need community and close people and friends to be around you. And if you're struggling with mental illness of any type or mood disorders or suicidality or psychosis, it's good to have a safety plan. And there are a lot of templates for a safety plan on the internet that you can look up. But basically what that is you and your community, your family, your friends that care about you. You're looking at what happens when I'm getting worse depressed or suicidal, or my moods are getting too extreme, or maybe psychosis or suicidality. Like, what are the danger signals for me? So you actually write that out so you know what they are. And then what are the things I can do that make me feel better or safe that I've done in the past? Like, actually write that out so everyone knows. Who are my support people and what are their phone numbers? Who are my support professional people and what are their phone numbers? Do I need to do anything now to keep my environment safe? And if so, what is that? Or what do I need to do to be in a safe environment? So that's what a safety plan is. So that can be part of your holistic plan for your mental health. Also, nature therapy, like I said, being outdoors and in the sun. Animals and pets. Where I work now, we do equine therapy.
Oh, yes.
So all of that is helpful in, again, I'm going back to polyvagal theory, which I'm a big proponent of, but it helps calm the system when you have a pet. And that's scientific too. It's not, just someone say it feels good. It actually works in calming your system. Mindfulness, meditation, and nutrition, all of these things can work together, whether you're taking supplements or prescription medication. Look beyond that to these other things that you can add to it to provide mental health for yourself. And as far as the polyvagal exercises go, you can look on YouTube because it's simple stuff. Like, what I like about polyvagal theory, and I'll just tell you a little story of myself. I was talking to a therapist. I was saying about anxiety, if it's on a 1 to 10 scale, with 1 being the least and 10 being the most. If I'm, say, a 1 to a 7, I can use my cognitive brain and use like cognitive behavior therapy and other rational things to calm me down. But actually, if you are having a panic attack or an anxiety attack, that rational part of your brain, it shuts down and you can't think about these things. That's why if you're anxious and someone asks you your kid's birthday, you often can't think of it. If you're anxious and you're taking a test, you're not going to remember the answers because that part of your brain is actually shut off because it's going to other parts of the blood supply is going to other parts of your brain. Polyvagal therapy bypasses the rational part where you have to think about it, and it actually calms you down. It's things like massaging your neck right here. It actually massages the polyvagal nerve. Putting a cold wash rag on your neck or face, or even a cold water plunge. Breathing techniques where your exhale is slightly longer than your inhale. All of these go straight to the physiology, and it bypasses that part of your brain that is shut off when you are anxious. So those things can work for someone that has a pretty severe anxiety. Like I said, it bypasses the part of your brain that has to think, which is often turned off when you're really anxious. Yeah. So that's another holistic thing that people can look into that works besides medication. And some of these things can work really fast, like the polyvagal exercise techniques are meant to immediately go to your physiology and work and help calm you down.
Well, that's really helpful information because it's so simple and practical and really can be done in a moment. if you feel like a panic attack coming on or something like that.
Yeah.
And I think so many of the things you talked about, they're just healthy for us anyway, even if we don't have a diagnosis of a mental health issue. It's just healthy to be in community and to,
Yes.
to look at our nutrition and all of those things. So some of those things are kind of preventative too, to keep our mental health, keep us well, so that
Absolutely. Yeah.
maybe we won't have to. We all have bad days. We all have days when maybe we're a little bit depressed, but not necessarily at a point of looking at medication. So some of these things might even be able to, help prevent and help maintain mental health.
Yes, absolutely. Mm-hmm.
Well, I appreciate all the information that you've given us, Angie, and it's just that broad range of the medical and the more holistic approaches that we can have. Is there anything else that you would like to tell our listeners, or thoughts that you have for them if they're trying to improve their mental health or maintain their mental health?
Yeah, I would like to talk about if you're in a crisis like suicidality, just because I've experienced that in my own family, like where you can turn to. 988 is the national number that you can text or call, and they'll do it by text or call. And you can talk to someone that will get you in touch, that can get you help. It's a myth that if you talk to someone about suicidality, that will make them more suicidal, or ask them if they have a plan, that it's going to make it worse. It won't. If you have someone that's depressed and you suspect this might be happening, just ask them if they've had thoughts of harming themselves and if they've thought about how they might do it, and get them help. This is not something you keep secret. If someone says, but you can't tell anybody, that's the one secret you don't want to keep. If someone is suicidal, you can't deal with that by yourself. They need to get help. So 988 is a number nationwide you can use. And there's also a template there, like I was talking about a wellness plan on their website. They have a template for that. They're also good for a disaster relief. If you're suffering like after a hurricane or something like that, you can call them for that. They help with all kinds of mental health issues. And besides the 988 number, just a reminder that a lot of insurance companies also have a crisis line that you can call. Sometimes it'll actually be listed on your insurance card, or you can call the main number and get that help that you need. And hospitals sometimes have their own nurse that you can talk to, or a crisis line. So that's another option. And I wouldn't say this is a last resort, but it's something to remember, that if someone is actively suicidal, you can call for a welfare check or a wellness check from the police. And sometimes some states have policemen that are trained specifically in mental health issues. And it's important that when you call, you let them know that you are calling for a mental health crisis. So they'll send someone, if they have someone trained in that. And if need be, they can get the person to the hospital where they can get evaluated. But that's another option. But a good one to remember is just that 988 number for anyone needing assistance, like in an emergency.
And are there other resources in terms of like friends or family that may be concerned about a friend or a loved one either being suicidal or even just struggling with their mental health?
NAMI is another excellent resource, National Alliance on Mental Illness. They have resources for family members dealing with someone that has mental or struggling with a mental illness, and also for the person struggling with a mental illness. They have lots of good resources at NAMI as well.
And so it's just really important to reach out and don't feel like you have to struggle on your own or watch someone struggle on their own, but really do reach out for help.
Right. Yes.
Well, thank you so much, Angie. This has been very valuable information for our listeners. And definitely, if you have any questions, if you have any follow-up questions, we can get those to Angie or if you need resources. I know Jonathan, our podcast producer, puts resources into the show notes. So some of those will be there, but we definitely want to be sure folks are able to access the help that they need. I guess just one final question that just occurred to me, Angie, and I don't know if you know this or have any experience. If when people are contacting or calling 988 or any of those things, if they have a disability, do you know if the individuals they would be interacting with would have any experience, with that? I don't know if it's required you fill out forms or something that a person with vision loss might have difficulty with, or a person with some hearing loss might have difficulty, speaking to someone, and you may not. That just occurred to me.
Well, I think 988 has been around since 2005, so I believe that they have probably are up to speed with dealing with different disabilities or issues that might be needed. I know that they work with multiple languages, and again, there's text options as well as talking options. I do know that. So, I can't say with 100% that I know exactly what they have, but I would assume that's there since they've been around since 2005.
Right.
Yeah.
I know sometimes folks hesitate to reach out because there's just sometimes they've experienced in other situations or dealing with other medical professionals, obstacles, or, well, here you need to fill out these forms and they're not accessible or things like that. So I just thought I would ask that question, but definitely reach out for help and don't give up if you do encounter some accessibility issues. Reach out to another organization, but don't give up on that. So, well, thank you, Angie, so much. You can contact us with any feedback at our website, which is www.aftersight.org. You can contact us at aftersight.org if you have any questions. But this conversation with Angie is wrapping up our month-long discussion on mental health. And next month, we will start looking at newly adapting to vision loss. So for individuals who are just starting to lose vision, or maybe you're partway into losing vision, or your condition is one that has ongoing vision loss for a period of time, this next month we'll have some great information for you as well. So we hope this program, as well as all of our podcasts, help you navigate your life with vision loss.